classroom. Welcome back for you regulars. For those of you who might not have been here before, I'm Joan Fitzgerald, Interim Dean of the School of Public Policy. The Open Classroom is a project we've been running since 2008, when we started with Barry Bluestone and Paul Grogan of Boston Foundation talking about urban America. Since then, we've brought eminent thinkers from around the world and from our own campus here to talk about a variety of subjects. We've given policy advice to the next president twice. We've given policy advice to the next governor once, and I think we'll be doing it again soon. We've had a number of topics: food policy, climate change policy, and this semester our topic, as you can see, is policy for a healthy America. We have three distinguished professors from Northeastern leading this open classroom: John Arbach from the Bouvet College of Health Sciences, Tim Hawk, who's jointly appointed in the DeMoore McKim School of Business, and Wendy Parmet from the School of Law. And we are honored tonight to be hosting Mayor Menino and his staff to talk about health policy in Boston. So I'm going to turn it over to John Arbach, who will introduce tonight's speakers.
Good evening, everyone. Good evening. Good evening, Mayor.
Good evening, John.
It is truly an honor and a pleasure to welcome Mayor Menino here this evening. In the 20 years that the mayor has held this post, he's transformed the city in more ways than is possible to list, and you'll be happy to hear I won't list them, but it's a long list. But at the heart of his work has been his concern for the health and the well-being of the residents of the city. This is a mayor who has been out front on virtually every single health issue regarding quality health care and every single health issue regarding public health and prevention. He cares deeply about the health and well-being of the residents of the city. So I'll give you a few examples of the work that he's done that is of enormous significance in terms of the health of the city of Boston. Early in his tenure, or relatively early, he led the effort to create what is now Boston Medical Center. And he did so by transforming what was the city's long-term Department of Health and Human Services and Boston City Hospital, which was economically failing, and also failing to have the resources necessary to provide the kind of care that was that he thought was acceptable for all the residents of the city. And he knew that it had to become a nonprofit hospital in order to have those resources and to provide the level of care that he considered essential for every resident of the city. So he took on the big challenge of doing that. Many people said it couldn't be done, Mayor. You stuck with it. And it was an enormous success against a lot of people who said you couldn't make that transformation. The Boston Medical Center now provides excellent care. The population that was served by Boston City Hospital is served by Boston Medical Center as well as the other hospitals, because the mayor fought for people to have access to any hospital they wanted to go to. Another example of his outstanding work has been his support for the community health centers in the city. The mayor fought for increased funding for those centers, and he worked diligently with the health center directors to find new space and to make sure that there was adequate funding and support for the construction of some of the country's most beautiful health centers now. And we're going to hear from the executive director of one of those in just a little while ago. He also created the Boston Public Health Commission, the City of Boston's health department, out of that earlier effort I mentioned that transformed the city from having a health and hospitals unit to having Boston Medical Center and the Boston Public Health Commission. And Boston Public Health Commission is thought of as one of the strongest and most innovative local health departments in the country. And he had the good sense to hire Barbara Ferrer as his executive director of the Boston Public Health Commission, really one of the most brilliant public health leaders in the country.
What happened to you?
Yeah,
I think you improved with age, Mayor. You picked the right person the second time. He's overseen many initiatives to prevent and screen and guarantee health quality of treatment for a wide range of different health issues. And the list is really long, and with each of these, if I said to the mayor, just quickly say what you did on this issue, he'd be able to start talking about the specifics. He knows these issues well. So here's just a short list. This isn't the complete list of the work that he's done. He's done work on cancer, on heart disease, on HIV, on violence prevention, substance abuse, infant mortality, diabetes, asthma, on and on. There literally isn't a health issue that this mayor hasn't been personally involved in providing direction and leadership on. He has earned the title of not just mayor of the city of Boston, but the mayor of public health in the rest of the country. People around the country look to this mayor for innovation, leadership, and inspiration. His interest in health, though, I think very importantly extends beyond specifically just looking at healthcare facilities and public health, but really looking at how can we change the conditions in people's lives so that they're more likely to be healthy. He has changed the city in lots of ways that have encouraged healthier behaviors. That includes making it easier to bike and walk in the city. Those of you who are new to Boston may take for granted we have bike lanes on the street and we have hubway, available bikes for people. That didn't exist before the mayor. That was a reflection of his commitment to higher quality of care and wellness for the population. We have less violence in Boston, so parents are much more likely to have their children safely going to parks, walking to schools as a result of his efforts. He's also embraced environmentalism and his promotion of clean energy, recycling, energy-efficient building projects at the same time that he was aggressively expanding the number of housing units in the city. And he struggled mightily to make our city a place where racism and discrimination were not welcome. He envisioned a city where people of all races and ethnicities feel welcomed and respected. And all of these factors that I've mentioned contribute to our health, not just the provision of healthcare services. And the mayor's been extraordinary in his determination to think big about the factors that influence the health and well-being of the city in order to promote a city where the people can flourish. Mayor, we're grateful for all you've done to make the city a healthier city, and it seems impossible, quite frankly, to imagine a city without you at the helm of it. Impossible.
Thank you, John, for the introduction. I was running for office. Well, you voted for a lot of things, but I have 109 days left. I'll make the most of it. I just want to say it's really great to be at Northeastern University once again with John Auerbach, Dean Fitzgerald. Thanks for having me here this evening. I also, one right over this, Emily Ellison. 2008, she was the captain of NCAA championship volleyball team from Northeastern. Actually, what's her name? Volleyball champion or men's soccer? John Auerbach is a very special individual. He's one of the top public experts, health experts in our nation. So fortunate to have head of the Boston Health Commission in Northeastern. Is very fortunate to have him with you today, and it's a great asset. I also want to thank our special guest today, Azzy Young, who does such a great job at the Mattapan Community Health Center. I'm glad she's finished the building. She hasn't picked my pocket in about 6 months. She's at me all the time. She's got a great, you have to go to Mattapan and see the beautiful health center that she's been building. Dr. Julia Bixby used to be my doctor until she became the state's doctor. When she was still my doctor. And Matt Fishman from Partners Healthcare was always willing to help us through the issue. I mean, he's one of those go-to guys. If you have an idea about healthcare, go to Matt Fishman. Thank you, Matt. Thank you, Ozzy. Thank you, Judy. I'm very happy to join them, all of you, to share some of my views on public health. I saw all of them up here, so why should I sit down now? I see public health really as an extension of what I believe is the purpose of government. We should be in the business of helping people. The healthcare expertise we have in Boston should benefit all Bostonians to prevent illness in our city. When adults are healthy, they can work more productively, providing for their family, and contributing to our economy. When our kids are healthy, they can do better in school and take part in sports. When our workers are healthy, they lower the cost of healthcare for improving their own physical health and financial health of the employers. I am not an expert, let me tell you. I just try to make the city work for everyone. There are three major principles that guide the way I lead on public health. I'll use them to explain my approach to public health and talk about some of the things we have done and are currently working on. The first principle is being able to take a political risk. It's not about doing what's going to help you as a politician. It's about doing what's going to help improve the lives of your constituents, the people living in your city. Like the Boston first health commissioner, a man named Paul Revere. You can't be afraid to sound an alarm. Let's face it, causing a little controversy is kind of fun. I have a couple of examples of that fun. The first one deals with AIDS. John talked about it a little bit. When I was a city councilor, representing Hyde Park and Rosdale, the AIDS epidemic was really hitting our city. I read a study that said distributing free needles would slow the transmission of HIV. This made sense to me, so I spoke out about it. Doesn't seem too controversial now, but back in the late 1980s, it was very controversial. Some people thought I was crazy. They said AIDS isn't an issue in your district. Leave it alone. If you know why I represent Hyde Park and Rosdale. Everyone in Hyde Park and Rosdale, yeah. Very conservative. Right? Very conservative neighborhood. I took it on. I said we need to look at the needle exchange program that helps save people's lives. It would be crazy not to. I became mayor. I started a citywide clean needle exchange program, complete with outreach van, education, materials. I work with groups like AIDS Action, the Living Center, Community Serving, and Victory Program to continue education and care. I took all this up flack. I'll tell you what, I never regretted the decision one iota. Another issue that caused a big uproar, and John remembers this well, was my proposal to ban smoking in all workplaces, including bars and restaurants. This was all over the news. A lot of folks were upset with me. People told me to kill business for the restaurants and bars. Then I said it was un-American. It might be hard to imagine now, but this was a huge issue at that time. Against the backdrop, I called a press conference at Doyle's in Jamaica Plain. Anybody been to Doyle's? A place that had a lot of customers who probably weren't in favor of my proposal. We announced it on Valentine's Day too. It was my line. I said, I'm giving a gift to everyone's heart. Anyway, John and I headed out there. I could tell John was a little nervous. But I tell you what, we got there, made our case for the facts, and the owners of Doyle's supported the smoking ban. They stood with us, and so did much of the city after that. At the end of the day, the smoking ban was about protecting people from secondhand smoke. I think most people came to understand that. As for the bars and restaurants, I think they are doing just fine. In fact, I would argue that more people are going out because they don't have to deal with smoke anymore. When it comes to controversial issues, you can't be afraid to take a stand. I was lucky because I had John and many others standing beside me. But you also have to have a communications plan. You have to get the facts out there so people can understand what you are saying. That's how you cut through all the other nonsense, connect with people, and convince them that you're right. The second principle I want to talk about is collaboration. Mayors to give the speeches, but our success in Boston has been a true team effort. Start with Dr. Freer, my chairman of the Public Health Commission now. Barbara does a great job. We have really integrated public health into the work of many of our departments. You know, if I stay along as mayor, you gotta be careful. Barbara's gonna be in air. She banned everything else. I went along with it. But the next day step was we weren't able to breathe air. Right, Bob?
Oh, yeah.
Yeah. Did a great job for me. I also work with many partners outside of government. Partners Healthcare, the Blue Cross Blue Shield, to our community health centers, hospitals, and universities. There's 2 partnerships that we established: Boston Medical Center and new Public Health Commission with Moan. This was so important to me because we need to have a place where the people of Boston get quality care regardless of their ability to pay. It's through teamwork that Hubway, another initiative that we had, Hubway, which is the bike program, is such a great success. We work together to make all public housing in Boston smoke-free, so that children, adults can breathe freely. We partner with our pink and black ambassadors to educate African American women about the importance of breast cancer screening. This builds on the cancer program we have done in Boston, including being the first city in the country to grant every city employee up to 4 hours per year to use for cancer screening. And the first to send a mailing to all city residents to encourage them to get cancer screening. Funny thing about the cancer screening mailing, one of my colleagues was in my office one day. He saw the brochure. He said to me, can I take a look at it? He said, yeah. So I'm going to take it with me? Yeah. And so, about 2 months later, I got a copy of his brochure. Exactly the same copy as mine. Just took out of Boston, put his city in there. That's a true story. And I said, I'll tell you what state it's in. It's not a state that's got flooded right now. I think it's original government. Give me a break. Our Public Health Commission and our Police Department work hand in hand to reduce violence and shootings through our VIP program, the Violence Intervention Program that Barbara has. Our collaboration supports our parks, playgrounds, and community centers, so the residents have public spaces to exercise, and allows us to expand the number of community gardens in our city. Perhaps the most important collaboration I've been a part of on the public health issue, our effort to reduce racial and ethnic health disparities. I am deeply committed to racial and health justice. There's growing disparities in health and gaps in healthcare exist based on race, ethnicity, and income. Public health policy can do more than improve public health, can improve equity in our city, quality in our city. Thus, we have designed, developed, and implemented strategies to ensure that every Boston resident has the opportunity to reach their full health potential. Thanks to our efforts to forge partnerships, including with major area hospitals, we have become the first city in the nation with a uniform, regulated system of collecting patient data so that we can track some of the indicators that may influence healthcare disparities and make the necessary improvements to our healthcare system. We have come a long way since we began looking at disparities. I want to thank everyone in this room who has been a part of this. One of the things, seriously, I'm most proud of is when I saw the first report, we're the mecca of healthcare. In the shadows of those hospitals, those people weren't getting healthcare. Something's wrong with the system. That's why we took the issue on. We know disparities are not confined to hospital walls. And that we still have a long way to go. Comprehensively addressing social, racial, and ethnic disparities in health is a long-term commitment. The solutions must be multi-pronged and cross all sectors of industry. Whether we are in healthcare, public safety, housing, education, or neighborhood development, we must work together. As important as taking bold stands and building collaborations are, being in the neighborhoods might be even more important. In order to understand the public health issues out there, you have to be in the neighborhoods with the people. You have to listen to them in their homes, in their schools, in their workplaces, our community health centers and hospitals. Sometimes we go to those hospitals, we stay a little longer than we want. I think I supported Brigham Women's Hospital for about 6 months. That's right. I think the best way to learn and understand an issue is to go see it for yourself. The interaction I've had with people in our city and their communities are just as informative. maybe even more so than the briefing and policy papers I read at City Hall. It's through the people-focused approach that I really understand the problems of obesity, especially in our children. I would be coming to work in the morning and see kids eating potato chips while they wait for the school bus. Well, once when I was in the car, residents told me they didn't have enough places to get fresh and healthy food. And one time, at a shelter, I saw a child who was approximately 10 or 12 years old and already weighed over 200 pounds. Barbara was with me that day. It was just before Thanksgiving.
Yep.
We gave out turkeys. I said to Barbara, this kid, what shot does he have in life? That's how we really got to the obesity issue. We saw this kid. I thought to myself, this kid is really plagued with health problems. We have to do something about those problems. So from the very start of my administration, we made it a priority to attract more supermarkets to our neighborhoods. During my tenure with it, about 20 full-service grocery stores have opened throughout the city. We banned soda, here comes Barbara, we banned soda and sugary drinks in all public schools. That was the biggest battle I ever had. I had teachers and parents all against me because the Coke machines made money for their trips. And they said, you can't do that, take our money. I'll sell the water and stuff, that just makes it good. No, I won, Mayor's used to win, so. I hope the new mayor, whoever he is, or she is, understands that. We also expanded farmers market in every neighborhood. Make sure these fresh veggies and fruit are affordable for our Bounty Bucks program, which doubles the amount of dollars for SNAP recipients. We established my chicken farm at Long Island. I harvest an average of 25,000 pounds of fresh produce each year. If you haven't seen it, you have to check it out. It's just tremendous. We have 58 chickens out there. We have 8 acres of vegetables being grown up there. The point of all of this effort is helping our residents lead healthier lives because our residents help create them. Look, public health isn't this abstract issue that you just talked about. It's a real issue that impacts people's lives every day. It's our job as elected officials, academic experts, business leaders, graduate students, and doctors and nurses to make sure the policies we have put in place help people have a better life. It's not easy work. We want to take some bold stances and put people ahead of politics. We want to set your ego aside and work with others inside and outside of government. If you're accessible and are listening to people, do all these things, then create the conditions that make it possible for your city to work for all of its people, not just for some of them. That paragraph is really aimed at the merge of City Hospital and University Hospital. When I started as a city councilor. I had a hearing, and everybody said you can't do it. And one of the first things I did, I became mayor, is put a group together and study the possibilities. It took us 2 years, and what you see at Boston Medical Center today is a great institution doing great health care and still maintaining its mission of taking care of the most vulnerable of our society. And that's what it's all, the unions were complaining to me we were going to lose all their jobs. And I said, well, no, you're not going to lose your job. You have a better job. And that was so key to this. And there were some tough parts of that negotiation. There's one night, I don't know if anybody here negotiates. Some of you people do. And I'm sitting in a room with my negotiator. I come in, my staff, the union, and the university hospital. And so this is down to the last minute of the negotiations. And we had to get an agreement on labor. And people being stubborn. So I went to the meeting. I asked what the problem was. Well, we got these problems. I said, okay. I took my watch off. I said, I want this solved by 11 o'clock tonight or the deal's done. I'm out of here. You're not done? No merger. So it got to 11 o'clock. My guy who was at the table, they said to him, please don't call the mayor. We want to listen to him. So at 11 o'clock at night, he didn't call me. But he did call me at 3 o'clock in the morning, and he got the deal done. Sometimes in this stuff, you have to make it happen. And people are better off today because of the merger of Boston Medical Center, the health centers in the city, Ashley School, all the other health centers we have. Better for it. So I just say to all, health center, public health is the issue. And it cuts across so many different lines. Public safety, very important. Recreation, schools, you know, the health of individuals. If you're not healthy, you can't be a good educator. If you don't feel good, sometimes you turn to the wheel of crime to get some money, do some other things. And we do a VIP program. Barbara knows, we started. We go out knocking on doors in neighborhoods that are problems for us, and do surveys and find out what their needs are of the families. We try to fulfill some of those needs, not all of them, but some of those needs. We do a great job of it. I just say it's a wonderful thing. I just want to say thank you for this opportunity. And I just said, I'm the mayor, but these three experts, they're going to really tell you about public health. They're the experts. I thank you very much for listening to me. Thank you much. Thank you.
Mayor, here, I'll give this to my colleagues. We want to officially, on behalf of the professors and those of us who are involved in Open Classroom and Northeastern, present you with a token of our affection. So, Mayor, this is a... And again, this is an award that recognizes the mayor as the nation's public health leader. So thank you very much. Thank you very much.